I'm really excited to be here today because it's Vegfest. Yay! Fantastic event once a year in London. And my job here today is to talk to you about medical myth busting. Because many of you may already be vegan, many of you are sort of vegan curious, but undoubtedly you get a lot of questions from people. Things that sometimes it's quite hard to figure out how to answer. And if you haven't memorized an answer in the back of your mind, you can feel a bit stumped sometimes. And so that's why I'm here. My job today is to give you a few medical myth-busting answers for people so that they can feel informed and you can feel more confident about your dietary choices as well. Because it's not easy. We all have confused elderly relatives, for example. People that just don't understand why anybody would be vegan. They just don't get it. Or you might have friends and family who think that all you eat all day is lettuce leaves and could you possibly enjoy your food anymore, and it's so boring. But of course, we all know that's just not the case. And my job, as I said today, is to just give you a little bit more of an insight about some of the things that you could say to people if they're not sure about your lifestyle. So I'd just like to briefly tell you a little bit about who I am. My name is Dr. Gemma Newman, and I'm a senior GP partner at a busy NHS medical practice. And I went into medicine with the dream of helping people to get well. That was my goal. I wanted to connect with people, and I wanted to empower them to health. And 20 years ago, I started that medical journey. And I've been a GP now for nearly 15 years. I've been working at my surgery now for 10 years. And in that time, what I've begun to realize is that chronic diseases are getting more and more and more common. And they are incredibly hard to deal with. Now, these people live with these chronic conditions, and as doctors, we give them medications, we try to improve their quality of life, but we cannot cure these chronic diseases through medication alone, unfortunately. But I can honestly say, hand on heart, that the most rewarding part of my job nowadays, and over the last few years, is to help people with lifestyle changes. Not just things about, making sure they're getting enough sleep and exercise and rest and de-stressing, but specifically through plant-based nutrition. I have had the most incredible results that I've seen in my patients, and they have felt truly empowered. So it's a really special thing. So this talk today is going to have three different parts to it. The first part is a bit about the medical myth busting. I'll be going through a series of the most common questions that you guys might get, or in fact that you guys probably had yourselves. Remember, when you first started hearing about plant-based nutrition, no doubt you guys had the same questions. So I'm here just to kind of talk through those and give you more confidence. The second part of the talk is covering questions that vegans have for me. Some vegans, being vegan doesn't mean that you're well. And sometimes, people who are having a vegan lifestyle can still be stuck with regard to nutrition and lifestyle. So there's just a few questions about that which I'll cover. And then finally, at the end of the talk, I'll be bringing it all together, and I'll be giving you guys my top tips in helping people to adopt this way of life if they're interested, trying to approach these conversations with people and help them to have an open mind. So, are we ready to start with the first question? I wouldn't mind getting your hands up, actually. How many people get questions about calcium? Put your hands up if anyone here has had questions about calcium. Yes, yeah, really common. And that's understandable because I had the same questions as well. You can tell your family and friends and your loved ones the great news, and that is that when they have a plant source of calcium, it's actually far better absorbed into their bodies than the calcium that they get from cow's milk. And in fact, a lot of the research is now showing us that despite many studies having been done, unfortunately there is not an association between increased cow's milk consumption and increased bone mineral density. In fact, what we really find is that oftentimes the opposite is true. There's a few studies now showing that the higher the cow's milk consumption, There's an association there with not only higher risk of fracture, but even higher risk of mortality in men and women. So this slide shows you some of the common sources of calcium in a plant-based diet. As you can see, these are, it's an array of foods, so as long as you're having a nice array of greens and beans and fruits and vegetables and nuts and seeds, you're going to be getting plenty of calcium in your diet. And I believe, oh, hang on, skipped a slide. Yeah, this is the study I was mentioning earlier. So they were following over 100,000 people over the course of 20 years. And as I said, unfortunately, the correlations between increased milk consumption and increased bone strength just don't seem to hold up. If your friends ask you why might that be? One of the things that's coming out as a potential reason is the galactose content of the milk. And in lab studies, it's been shown to cause oxidative stress and inflammation and increased cellular aging. So that might be one of the reasons why, among many others. The next question, probably the most commonly asked question amongst all vegans. Please, I just want to see a show of hands. Who here has been asked where they get their protein from? Okay, yeah. So you've all had to face this question. And, sometimes it's hard not to be defensive because you get it so often. But that's okay, because just try to remember that you probably asked the same question once as well. And so what I tend to say to people when they ask me this is I will say, you know what? You're absolutely right to ask the question. I had the same question myself until I realized that all proteins come from plants. Even the essential amino acids, every kind of protein was made by plants before it was made by animals. And it's also quite a nice time to sort of say to them, all you're missing out on with a plant-based diet is the animal proteins, not the plant proteins. And why is that important? And the reason it's important is because the amino acids that you're getting from animal proteins tend to be a lot more sulfur forming, which means that the kidneys have to produce quite a lot of ammonia to allow for the right pH balance in the body. The blood is kept within a very strict pH balance and the kidneys do an incredible job. But of course, hyperfiltration occurs. That means that the kidneys have to work damn hard to try and process all these animal-based amino acids, and as a result, over time, it can damage your kidney function. Other amino acids that are important for health, things like methionine and leucine, we do need in the right amounts, but when you're having a lot of animal proteins, you're having far too many of them. So for example, methionine, it's an essential amino acid, but in excess it is linked to the potential for your cancer to spread because cancer cells are methionine dependent. They depend on methionine to thrive and to spread. So if you cut out the animal proteins in your diet, what you're doing is you're selectively starving the cancer cells, which is quite handy. Leucine is another one. Many studies now of cellular biology have shown us that the protein or the amino acid leucine is also associated with cellular aging. So if you're going to have an excess of leucine in your diet, your cells are going to get older faster, and so are you. So this might actually be a good time, if anyone is still sort of engaged in this conversation with you after all that, it might be a good time to talk to them about clean protein versus dirty protein. Because you've got to think about what you're getting in your protein package. When you have a plant-based protein, what you're getting is you're getting phytonutrients, you're getting antioxidants, you're getting insoluble starches, soluble starches. You're getting every other kind of great thing alongside your protein package. When you have animal products, you are getting some minerals, you are getting some vitamins, but what you're also getting is other things alongside in that protein package that you'd really rather not have. AGEs, AGEs, advanced glycation end products. These are toxins that are formed when you cook meat. And you can cook it any old how, it doesn't matter. Even slow-cooked meat still produces these same toxins, but barbecued meat is the worst. So you've got polyaromatic hydrocarbons, and many other toxins that are formed from these advanced glycation end products. What else are you getting? Well, if you're having factory farmed meat, you're also getting likely an excess of antibiotics, unfortunately, alongside that. You're getting extra heme iron. Now, heme iron is a form of iron which is more bioavailable. So, you think, well, that's great. I get more iron in my diet. It's absorbed more quickly. But actually, when you're absorbing that iron, unfortunately, it oxidizes very quickly in your body and it can cause damage. It's a bit like rust, but it's inside, so you can't see that. It causes oxidation, which again causes free radical formation and excess cellular aging. So it's not a good thing. What else are you getting? Well, dare I say it, you're getting the extra saturated fat and you're getting the extra dietary cholesterol. Because remember, we make cholesterol. We're actually pretty good at making cholesterol, and we need cholesterol. We use it as a precursor for many of the hormones in our bodies. But of course, we don't need it really from other animals because we're quite good at conserving it ourselves. The same with saturated fat. So, oh yes, I almost forgot, carnitine. Now, I'm going to talk about carnitine a little bit more later, but if you're having an excess of carnitine in your diet, what you're doing is, unfortunately, you're growing gut bacteria that are fantastic at digesting carnitine. And why is that a bad thing? Well, when your gut bacteria digest carnitine, they produce something called TMA. And your liver, when the TMA goes to your liver, it forms another toxin, TMAO. TMAO is damaging. It increases risk of damage to your endothelial lining. That's the inside of your blood vessels. It increases your risk of heart disease, increases your risk of kidney disease. It's really not a great idea. So bottom line is, if you have a whole food plant-based diet, then you're going to be getting plenty of protein and you're going to get a healthy protein package alongside that. And there's just a few examples in this slide of the kinds of plant proteins that you guys can enjoy. But don't forget, even fruits and vegetables contain plenty of protein. I think people often forget that it's not just about the lentils and the chickpeas and the beans. You can get protein from pretty much every whole food plant-based source that you eat, which is really important. And in fact, people are quite obsessed with protein, I have to say. And it might be worth saying to them that, in actual fact, we're getting far too much of it in our diets and about half the amount of fibre that we need. And so that's a big problem for meat eaters, I would say, on the whole. Whereas with a whole food plant-based diet, you are more likely to be getting the right amount of protein and the right amount of fibre. So it's win-win. We've covered calcium. We've covered protein. I want to just briefly talk about bodybuilders because nowadays it's becoming more and more popular to eat a plant-based bodybuilding diet. But of course, in months and years gone by, it was completely crazy. People say, surely if you're going to be building muscle, you're going to be having a lot of chicken breasts and you're going to be needing a lot of whey powder. And what about the eggs? And you guys probably already know because, well, there's a lot of people who are fit around here. In fact, Newman Delgado there at the top, he is here at Vegfest today. So if you guys haven't seen him, go downstairs and check out those plant-based muscles. Patrick Baboumian, he was here last year. He's in the middle there. He was here at Vegfest and he is the strongest man in Germany. He also holds the world log lift record. So really good job building muscles there without any kind of animal products. And Jahina Malik, she's on the far right there. She has been vegan her entire life. And she does not look like she has a protein deficiency to me. If you're not that interested in bodybuilding though, if you just kind of want to get fit and lean, just look at the Wimbledon superstars of this year. Both won Wimbledon with a plant-based diet. And so we don't need to worry about that anymore. Hopefully that myth has been well and truly dispelled. Carnitine, I mentioned it briefly just now. Some bodybuilders are worried about carnitine because it's from meat and you need it. And it's good for the brain and it's good for building muscles. And my answer to that is that yes, carnitine is important. But the great thing is we make it. Again, we're excellent at making carnitine. What we do is we use the amino acids lysine and methionine to make the right amount of carnitine to fulfill our dietary needs. That's because we're not lions. The great thing, I never forget hearing about this interview on TV. There was a vegan guy being interviewed by somebody on the telly, and the person said, but surely, what about lions? You know, we've got these canine teeth, you know, we need to eat meat. And the guy said, well, you know what, I noticed that when I came in the studio today, you didn't greet me by sniffing my bum. It's because you're not a lion. We're not lions. We can make enough carnitine. Now, carnitine is useful because it allows fatty acids to cross the mitochondrial membrane. Now, the mitochondria, they're the little powerhouses inside the cell. And so obviously you're going to need to be able to have functioning mitochondria. So it is important, but we make plenty. And interestingly, you can also get, you can also get small amounts of carnitine as well, ready-made in plant foods, which many people don't realise. So avocados, asparagus, wholemeal bread, these are all sources of ready-made carnitine, but you'll make plenty as long as you're eating enough sources of iron and vitamin C, which you will do with a healthy, whole food, plant-based diet. So, omega-3s. This is another really common question because this is the reason why fish is a health food for many people. They will say, we need fish because it contains omega-3 fatty acids. So what I would say to that is, you're absolutely right. The most beneficial thing about fish is the omega-3 fatty acids. However, once again, we can make omega-3 fatty acids ourselves through what we are eating. And the best plant-based sources of short-chain omega-3 fatty acids are things like flax seeds, hemp and walnut and chia seeds. You know, you will be able to get plenty of short-chain omega-3 fatty acids through these foods. So what happens in the body is that you have to convert these short-chain omega-3 fatty acids into long-chain omega-3 fatty acids. And, you know, most of us do that quite well. Some of us are not so good at doing that. So if you're one of those people that is not so great at that conversion process, and you think that you might need to get yourself some more omega-3s, you've got to ask yourself the question, where do the fish get them from? Because fish may not be that great at converting either. And the answer to that question is that fish swim in the ocean, they gulp on algae all day, and it's this algae, it's this plant protein from the ocean that actually creates the long-chain omega-3 fatty acids. So if you want the ready-made source, the purest source, then you can get that from an algae oil supplement, an EPA, DHA, algae-based supplement. And the beauty of that is that you're not going to be getting any of the heavy metals and the dioxins, the PCBs from the ocean, because, you know, fish unfortunately have been polluted over the years. It's terrible. So you're not going to be getting all those concentrated toxins within the algae oil supplement. So definitely something to consider. All right. Now, we've covered a few specific nutrients. Let's talk about nutrients in general. Won't being vegan mean that I have a nutrient deficiency? This is a really common concern. And I understand it because, you know, it's something that's more popular recently, but historically people don't necessarily understand veganism. And, you know, I had to research this myself because I wanted to be sure that, you know, we weren't missing out on anything. And the good news is that with my research, I was able to say definitively having a whole food plant-based diet as part of your vegan lifestyle will ensure that you have every nutrient that you need as long as you're well planned with it. So I just wanted to say that when I was doing my research on this, what I actually realized is that many of us, and you could say this to your family or your friends, many of us are in fact overfed and undernourished. If you're looking at the data from the National Diet and Nutrition Survey from just this year, it shows us that the majority of us only have 8% of our diet coming from fruits and coming from vegetables. 8%, which is absolutely shocking. And over 50% of what we're eating is actually from processed foods. So this study was quite shocking to me. It was released recently, and what it was showing was that with every 10% rise in the consumption of processed foods in our diet, there was a corresponding 10% increased risk or potential increased risk of cancer. So for every 10% increase in what we eat in our diet that is from processed foods, there was a corresponding 10% increase in the risk of cancer. So this is a big problem, not just for meat eaters, for vegans as well, but when you're having a whole food plant-based lifestyle, you will do a lot to negate those risks. This is a table which just goes into a little bit more detail about the nutrient profile of a plant-based diet. It's extrapolated from the USDA database, and it's taken from the 100 Calories All UK website. And what I realized when I looked at this data is that 3 of the top 4 diets in terms of micronutrient density are in fact plant-based diets. 3 of the top 4 are plant-based diets. Number 1 is the Nutritarian diet, which was made by Dr. Joel Fuhrman. He is a fantastic speaker. He's a physician from the US. If you're not familiar with him, do check out his work. And he talks about having a high nutrient density diet with the minimum of macronutrients, which is proteins and carbs and fats. Keto is quite low down the list. It's got quite a low level of folate, which you could imagine because there's not that many vegetables in most people's keto interpretation. And what I thought was interesting looking at some of the data was that the plant-based diets were the only diets with enough magnesium and enough potassium, which are really important minerals for our health. And they were also the diets that were lowest in sodium, which is crucial for blood pressure control. But it's not all about micronutrients. We have to look at other things as well. And this table is quite interesting because it shows us the macronutrient profile of each of the dietary styles. And what you can see from this is that when you go for a really healthy, whole food, high-fat, low-carb diet, not only is it one of the most expensive eating patterns, but also, although it's high in micronutrients, it's actually very low when you're looking at the other macronutrients that you get. So, for example, it scores low, number 11 on the list now, because it's quite high in dietary cholesterol, it's high in saturated fat, and it's very low in fiber. So, how do we translate this micronutrient information into real life results? What happens in real free-range humans? Well, we know that it's not all about food. It's about lifestyle. It's about having a sense of purpose. It's about staying active into your later years. It's about getting the right amount of sleep. But this lovely lady, I don't know if you can see, she's 102, and she's called Kumara Nakasato. She is a hugely inspirational lady from Okinawa, which is a small island off the coast of Japan. And her philosophy on living a long life is eat your vegetables, be kind to people, and smile. Now, Okinawa is one of the 5 blue zones. The blue zones are the areas in the world with the highest longevity, the highest proportion of centenarians. And Okinawa is one of those areas. Icaria in Greece and Sardinia in Italy, and you've got the Loma Lindens in California, and you have a small island as well off the coast of Costa Rica. These are the top 5 blue zones. This guy, Dan Buettner, he is a researcher and journalist, and he brought the blue zones into the public consciousness. And what he began to realize when he was researching all of this was that when you look at the diet of the people in the blue zones, what you notice is that they are 95% plant-based in what they're eating. Only 5% of what they're eating is animal products. So for the majority of these populations, they may have an animal product maybe once, twice, 3 times a month, if that. But they tend to have most of their diet centered around whole plant foods. And that does seem to corroborate the micronutrient data that I just talked about. What I also wanted to draw your attention to is something that I found particularly interesting about this cohort of people, and that is the issue of, well, what about cutting out all animal products? Because people say, well, there haven't been any long-term vegan populations to really compare. And I'd like to draw your attention to two parts of the blue zone which I find most interesting. First of all, we've got the Icarians. Now they have a particularly plant slant Mediterranean diet. We know from many studies that the Mediterranean diet has a lot of benefits for health, but the Icarians, the ones that live the longest, they tend to have far more vegetables. They've got this so-called vegetarian diet compared to the other forms of Mediterranean diet that you might see in other parts of the Mediterranean. But also, we've got the Loma lindens. Remember I talked about there's a population, the only blue zone in North America, the only English-speaking blue zone, and this is in California. Now, the interesting thing about the Loma lindens that they were studying is that they were Seventh-day Adventists. Now, these are a population of people that have really great social cohesion. They've got a religious structure, they've got good community links, but they also tend to look after themselves generally. So, they don't necessarily drink or take drugs or, have an unactive lifestyle. But what they do differ in a lot of the time is the things that they eat. And some of the Loma linden Adventists are strict vegans. What's interesting to me is if we study all the different Adventist groups in terms of what they eat, you get some very consistent results. When you look at nearly 61,000 people, what you see is that the less animal products they were eating, the less chance that they had of being overweight. And again, you're looking at the data, the less chance they have of developing type 2 diabetes. So if you're looking at the vegans down in blue, they had about a 78% reduced risk of developing type 2 diabetes if you compare them to the meat-eating Adventists. And these are really healthy people on the whole, certainly for North American people. So I think what that proves to us is that having a whole food plant-based diet is, on many levels, essentially really, really healthy for us. Got a clicky slide there. Is it safe to be pregnant and vegan? Is it safe to raise a child vegan? Now, these are important questions because when you're growing a human or you're raising one, you've got to make sure that they're getting the right amount of nutrients. And I can say from my research that if you have a well-planned whole food plant-based diet, it is indeed safe to do so. And in fact, the American Dietetic Association tell us that it is appropriate for all stages in the life cycle, particularly with benefits for preventing certain diseases and treating certain diseases. Now, what diseases are we talking about here? Well, we're talking about heart disease and cancer. Heart disease and cancer are number 1 and number 2 killers in the Western world. Just think about that for a minute. If you have a dietary pattern which has the power to prevent and treat the top 2 causes of death in the Western world, then why wouldn't it be the default recommended diet for these people? Meghan Markle, poor thing, she was told to quit her plant slant diet, her weekday plant-based diet because of concerns about the pregnancy, and I would say that that is a tremendous shame for that reason. So, if you have a child, you're raising a child vegan, what do you actually need to know? Well, I read an interesting study that was actually published in the American Journal of Clinical Nutrition, and it was following British vegan children from 1968 throughout their childhood for about 13 years, and some of them were followed even from before birth. And what did they discover? They discovered that the vegan children had a higher, healthier nutrient density than the omnivorous controls. What they had less of was calcium and dietary fat. Now, I don't know about you, but I think in terms of dietary fat, it's probably a pretty good thing that they had less of it, especially with today's obesity epidemic. Now, the thing I took from this data is that, having children myself, I realized that sometimes kids decide that they don't want to eat anymore, even when their energy requirements haven't yet been fulfilled, which I think is a problem whatever diet you choose to eat. So my advice would be, if you're raising a child vegan, is to make sure that they're getting the high energy, high healthy fat meals so that they're getting the right amount of energy for their growing needs. So, for example, nut butters, nuts, seeds, pulses. Now these are all really important food groups to encourage your child to have the most of before they start having other things that are less energy dense. I would also recommend that a B12 supplement is essential. Also that you give them a vitamin D supplement, because like all of us in the UK, or certainly the vast majority of us, we're just not getting enough vitamin D through sunlight exposure. So making sure that your child has enough, I think, is crucially important. And again, I particularly favour EPA DHA supplements as well, because you're giving them a ready-made long-chain omega-3 that they can use for their brain and heart health for the future. If you want to know a little bit more about my specific advice on pregnancy and raising children vegan, you can always go over to Plant-Based News. They have a video guide that you can access if you want to know more. What about elderly and frail people? Do we have to be careful about avoiding meat and avoiding dairy in these people? Well, I think probably the most pertinent question there would be, if somebody has reached an age where they are elderly and frail, the chances are that they've probably already started to experience some of the diseases that are the ravages of the Western world. They may have already had cancer, because 1 in 2 of us get cancer these days. They may already have signs of heart disease. So I would suggest that having a whole food plant-based diet approach would actually be really important for these people, not just to improve their health for now, but potentially improve it in the years down the line. The most important thing I would suggest, there we go. The most important thing I would suggest is actually trying to make sure that they stay active. We lose muscle mass every year from about the age of 35. And so if you're not using it, you're really losing it. So I would say for elderly populations who have a whole food plant-based diet, encourage them to do some resistance training, maybe even just a can of baked beans, get them to start doing some mini weights if you can, get them to use their muscles to go outside, to get some exercise. And if they are sparse eaters, then there's no harm in giving them a plant-based protein supplement as well, so that they can increase their muscle mass with that as well as with exercise. Again, sleep is crucially important, both in the elderly populations and younger populations, to avoid certain neurodegenerative diseases such as Alzheimer's and Parkinson's. And crucially, a whole food plant-based diet can do tremendous things towards improving the chances of those diseases as well. My favourite question that I get quite a lot is about soy. I don't know if you guys get that as much as I do. So could you raise your hands, any of you who've had questions about soy? Is that a popular one? Yeah, okay, still quite a lot of you. Not as popular as the protein question, but it's still a big question. People really worry about man boobs, which, I understand. But the good news is soy does not give you man boobs. Soy is a wonderful thing. It's a selective estrogen receptor modulator. A selective estrogen receptor modulator, or a SERM. And how does that make it so special? Well, because it's a plant estrogen, a phytoestrogen, that basically attaches to the alpha or the beta estrogen receptors. Now, when you have a mammalian estrogen, so when you have an estrogen from a human or from an animal, they tend to bind to the alpha estrogen receptors in the body, which are mostly in the womb and in the liver and places like that. When you have soy, it tends to bind preferentially to the beta estrogen receptors, which are primarily located in your bones. So the incredible thing about soy is that when you have more soy, you're actually increasing your bone mineral density, whilst at the same time reducing your risk of things like breast cancer and endometrial cancer and hot flushes if you're menopausal. And so this is the key to how soy is so beneficial and so useful, because it selectively binds preferentially to these beta estrogen receptors, which means it has all of the benefits and none of the downsides. What I found actually quite interesting, I read one study about this, and They did a study on women who were having either control group, they were having progestogen cream, or they were having a couple of glasses of soy milk a day, and they wanted to monitor their bone mineral density over the course of a couple of years. And what was really interesting was that the control group had a decline in their bone mineral density over that 2-year period. And the good news was with the progestogen cream group, they had less of a decline in their bone mineral density, so it was useful to them to take the progestogen cream. But the soy milk group actually had an increase in their bone mineral density over the course of those 2 years. So, there are many studies to show that it has these tremendous benefits. So, if people are really obsessed with man boobs and they just don't want man boobs, what you can tell them is, in actual fact, the most potent phytoestrogen so far discovered, and it is a phytoestrogen found in beer. So it's contained in hops, which is the bittering agent that you use to ferment beer. And the curious thing is that when you have beer, you let the beer sort of mix in with your fecal microbes, and it actually, it's disgusting, isn't it? And it actually increases the effect of this phytoestrogen by about 10 times. So the effect of this phytoestrogen in your body is far stronger than you would expect it to be from lab studies. So the bottom line is, unfortunately, the more beer you drink, the more likely you're going to get a beer belly and man boobs. So you have been warned, you guys. Right, so I think we've kind of come to the end now of our myth-busting part of the talk. What I want to just briefly touch on now is questions from, there we go, questions from vegans. Because having a vegan lifestyle does not necessarily mean that you're eating a whole foods plant-based diet. And people sometimes ask me, do I have to take a supplement to be healthy? Maybe they're having a whole food plant-based diet and they're thinking that should be enough. And in my opinion, you do unfortunately need a supplement because we're not living in the same environment that we were years ago. And hopefully you will all know the number one supplement that all vegans need. Yes, it's B12. And you've done your homework, I'm sure. But just to recap, vitamin B12 is made by microbes in the soil. And so unless you're having unwashed fruits and vegetables and drinking unfiltered and untreated water, you're not going to get enough vitamin B12 unless you take a supplement. What's interesting to me is that the factory farmed animals also have to take a vitamin B12 supplement because they're not getting enough from their food. And even if you have grass-fed cows, sometimes if the soil isn't B12 rich, they will also need supplementation. The same can be true for anyone over the age of 50, anyone on metformin, anyone taking a proton pump inhibitor, which is a medication to prevent indigestion and acid reflux. All of these things will potentially reduce the amount that you absorb B12. So B12 is often a big issue for meat eaters as well. Crucially important to take your B12 supplement. Right, so this is my recommendation for complete optimization with a whole food plant-based diet. I like to tell people to have a vitamin B12 spray. The reason I particularly like spray is because it comes in the methylcobalamin form, which means it's more bioavailable. The other great thing about a spray is that you can absorb it sublingually, you can absorb it through your tongue. You don't have to worry about absorbing it through your stomach or digestive tract. So that's the one that I like to recommend for that reason. I also suggest that you take a vitamin D supplement. There's plenty of vegan D3 supplements on the market now. And again, we've discussed omega-3s. I think that a ready-made EPA DHA source is really useful, especially if you're a child, if you're pregnant, or if you're elderly. So sometimes vegans have asked me, look, is there anything else I could possibly think about? And I would say, well, probably iodine. Many people, regardless of their diet, can sometimes have an iodine deficiency. And most people that have a standard Western diet will tend to get iodine from cow's milk. Reportedly, that's because of the vats that they use to clean the milk. I haven't been able to verify that either way, but if you're plant-based or if you're vegan, you're not going to be getting iodine from those sources. So how would you get it instead? Things like sea vegetables, nori sheets. I love nori sheets because you use them for sushi and kids love to nibble on them as a little snack. You can also get it from ashwaghanda, which is an Ayurvedic herb. It's an adaptogenic herb, which means that if you have it and you've got a low thyroid function, it has a similar effect as if you have it if you've got high thyroid function. It just helps to regulate your body's functioning. Sometimes with kelp supplements, which also contain iodine, you have to be careful because they have a variable amount of iodine in them. Sometimes it can be too much, which can also disrupt your thyroid function. And so I would suggest selenium is important to remember alongside your iodine. Selenium is most commonly found in Brazil nuts, but you can also get it from beans and peas and the wonderful soy. If you're not keen on all these foods, then I guess you could try and just take a Veg1 supplement, which does contain the right amount of iodine and selenium. But there we go. I thought I would give you the natural sources because, in my opinion, it's always good to get it from the food where you can. So someone else asked me, well, actually a couple of people have asked me, about trying it for a short time and feeling quite bloated and unwell. So they decided to give it up because, it just didn't suit them. And I know, I empathise with these people. You don't like to feel bloated. You don't like to have gassy, sort of windy days. But I would try and encourage you to stick with it if you can, because what's happening here is your body is not quite used to digesting all of the galactosaligosaccharides, the types of starches that are contained within the legumes that you're eating, so the chickpeas and the lentils and the beans. And your gut microbiome will need a little bit of time to adjust to these food types. And why is it worth sticking with? Well, because these food types are absolutely incredible for keeping us healthy. They can draw cholesterol out from the bloodstream. They can attach to white blood cells, strengthening the gut lining. They can attach to receptors telling you that you're full. The great thing about them is that they can form short-chain fatty acids, which are just the ideal food for beneficial gut bugs. And these beneficial gut bugs can make great vitamins for us. They can boost our serotonin neurotransmitters, make us feel good. I cannot tell you the myriad of benefits if you aim to try and stick with it for just a little bit longer. Maybe gradually increase the amount of these foods if you can. Soaking them helps, rinsing them helps, cooking them slowly helps. Just kind of get your body used to it for a while, because I've already mentioned earlier in the talk about the dangers of the wrong kinds of gut microbes that you might be growing in your gut, especially if you're having a lot of animal products. Carnitine and choline in excess leads to toxic byproducts because of how your gut microbes digest them. So it's worth sticking with if you can. One more question I sometimes get from people who have enjoyed a vegan lifestyle for quite some time. It's not that common, but sometimes they feel unwell and they decide to stop because it didn't suit them. And I would have a lot of empathy for these people because they've had a vegan lifestyle probably for ethical or environmental reasons, and it sometimes is incredibly hard for them when they feel like it's because of their diet that they're not feeling well. And I would have so huge empathy with that. I personally have indulged in junk foods every so often, and I'm sure here at Vegfest we all will enjoy some of the cupcakes and gluten-rich meat replacements, but just making sure that they're not a staple of the diet, I think, is really important. Emphasising whole foods, plant foods is ideal. But also, things like alcohol, they can strip your gut microbiome and they can cause issues with so-called leaky gut after a while. So can things like caffeine and even medications that you take for other reasons. And sometimes people react to the legumes and the whole grains in their diet for other reasons that you haven't perhaps been able to explore. Antibiotics, as one example, if someone's been unwell and they've had to have repeated courses of antibiotics, it can really disrupt their beneficial gut microbes, which leads to leaky gut and issues with small intestinal bacterial overgrowth. And these issues can be dealt with. Even with someone who's had long-term issues. You can go for a plant-based FODMAP diet, you can go for a plant-based autoimmune protocol. So it's worth chatting to a dietitian or nutritionist who is sympathetic to your needs so that you can get to the bottom of your specific problem. Briefly, Another thing that might be an issue is that you may have celiac disease, or of course, there's also a genetic variation called a methylation defect that you might have, which means that you're less able to absorb certain nutrients from your foods. You're not going to know this unless you get it tested, or at least open your mind to the possibility it might not just be because of your vegan lifestyle. So I have tremendous sympathy, but it's definitely worth seeking out a dietitian or a nutritionist if you're struggling. Most people do incredibly well on a whole food plant-based diet. The whole grains and legumes in a whole food plant-based diet have been shown time and again to boost our lifespan. This is a really good autoimmune protocol style diet. It's called the Paddison Program, and it was developed for people who have severe inflammatory rheumatoid arthritis, but it's also useful for anyone with autoimmune issues who wants to enjoy a healthy whole food plant-based diet. So I'm going to try and bring everything together for you now, because this is the most important part of the talk, in my opinion. We need to ask ourselves, how can we benefit the world? And when you answer this question for yourself, you are a step closer to happiness. When you are passionate about whole food plant-based nutrition, sometimes it's hard because you want to share the message, but you want to do it in a really positive way. And so I think it's worth sharing some of my experience in medicine to see if that can resonate with you guys. So the first thing I would say for me is, I always try to remember that eating is very emotional. People attach a lot of emotions to the food that they enjoy. And sometimes people say, oh, I could never do this because of that, or I could never do it because of this. And you have to listen with understanding and try and find something that you have in common with that person, that you can relate to them, or you can share with them. So you could say something like, you know what, I had the same problem too. This is what I thought, but then I realized this, or this helped me to see things differently. But you have to be real. You know, it can't be fake. You have to really aim to connect and empathize in order to be able to affect change, in my opinion, in my experience. The second thing, I like to find people's motivation for change, because it's different for everybody. In my line of work, clearly people are coming to me with medical problems, so I'm going to be saying things like, oh, wouldn't it be lovely if you could go to your niece's wedding without having to worry about your hip pain, or, you know, wouldn't it be wonderful not to have to take all these medications every day? And if you can imagine that sort of shared future, ideally you would create that positive future with them and then share the journey with them as well. But at least planting that seed gives them the chance to think about how this might benefit them and their lives in the future. I also like to suggest some simple swaps to people just so that they can get their heads around what it might mean. So for example, if they love a chicken curry, I'll tell them to have a chickpea curry, and here's a great recipe. If they like a beef chili, I tell them about a 3-bean chili that they might love. You know, it's just little steps to help them along the way so they can imagine how this could fit in to their future life. Because ultimately, if you can share that journey with them and be positive and give them some simple solutions, then essentially what you're doing is you're being the change that you want to see in the world, and you're helping draw people to you rather than drawing people away from you. So I think that that's really important. And so here comes the end of my talk. If you'd like to find out more information, you can follow me on Instagram at plantpowerdoctor. I would absolutely love it if you've taken photographs today. Please tag me in them. Tell me what you liked about the talk, if there's anything new that you learned. And you can also follow me on Facebook at Dr. Gemma Newman. And also, I'd love to share with you some of the references I was talking about today. It's quite difficult when you have a screen like this to understand everything that's flashing quite quickly. So please email me. This is my email address, gemmanewman@doctors.org.uk. If you email me, I promise you, I will email you back and I will give you all of the references that I've talked about today and more, so you can do your own learning and do your own research. But for now, what I want to say is thank you so much for listening.